This won't be your last visit to California.
You'll be back.
Go to landofwineandfood.com.
Why use a basic cleanser that stops there? Olay Skin Loving Cleansers do more. Hydrate and cleanse. Clarify and cleanse. Even age-defying cleansers. Why just cleanse? Do more for your skin with Olay. Love the skin you're in.
Going berry picking? Pick Metamucil Berry Burst Fiber Supplement. It has that ripe, succulent berry flavor, and it's infused with 100% psyllium fiber. Go on, try new Metamucil Berry Burst.
Welcome back to the Health Edition of Talk TV. I'm Dr. Carl Cabasel, and today we're talking about food intolerance, everything from allergies to simple sensitivities. And I'm here with naturopath Dr. Mubina Jiwa. And before the break, we were just talking about some of the approaches to food intolerances in particular. Is your approach in terms of your patients, is it different for children versus adults?
Not necessarily, just in terms of eliminating certain things. You might want to make sure that children are actually getting certain vitamins and minerals more so than adults or different age groups. Like women, you want to make sure they're having calcium. So I would just alter it in that way. But in terms of the testing or in terms of revealing the sensitivities, it is not.
Same thing. Okay. Let's go to the phones now and talk to Rob in Thornhill. Hi, Rob. Rob, are you there?
I'm there.
Hi. What's your question today, Rob?
Hi. Quick question. Not every time, but occasionally I find when I eat certain like cheeses or milk and other dairy products, I mean, I have dairy all the time, but sometimes when I have it, I find for an extended period of time afterwards, I have a funny sort of taste in my mouth, and I can't really get rid of it. I chew gum sometimes afterwards. I'll go and brush my teeth, and like I find that after like the mint of the gum or the toothpaste wears off, I still have that funny taste in my mouth. I'm wondering does that sound like something from the food, or does that sound like some other oral hygiene kind of problem?
It could be another oral hygiene kind of problem. It could also be related to the food. One of the ways to figure it out is by trying to figure out which cheeses you're eating. It could be a certain type of cheese that you're eating. If it is a certain specific cheese that you're eating, just eliminating that might help. It also could just be that you're not digesting that particular cheese very well. So if you're not digesting it well, taking something like a digestive enzyme or having things that help with digestion like pineapple or papaya could help your problem a little bit.
For sure. But as far as you're saying that could be a digestion thing, why would I be tasting it in my mouth so much and not so much in my stomach perhaps?
Well, the digestive tract is sort of a long tube, so it starts with your mouth and it ends in your rectum, and all the way along you can have any kind of like remainder of a taste or anything. That's why when you have heartburn or something, you can taste that in your mouth sometimes.
Okay.
So it could be some sort of a regurgitation or heartburn or some kind of taste in that regard.
Rob, what kind of taste are you talking about?
I don't even know how to explain it. It's sort of like I honestly couldn't describe it. I wish I could. But it's sort of like throughout, or it's around my cheeks, and it's sort of like it's just kind of around my mouth. It's not in any one location. Now, the thing that I find is that, as I say, some of the cheese that I'm eating, it's cheese that I eat almost on a daily basis. Just I find sometimes I get it and sometimes I don't.
It could be something else that you're eating and not the cheese. That's the tricky thing about food sensitivities is you don't know exactly what it is that's causing you the problem. So
right, because you're just saying that milk and dairy products were a high thing, and I just happened to notice it happened actually 2 days ago.
Right.
The last thing I remember eating was the cheese. And then next thing I know, for the rest of the afternoon, I had this funny taste in my mouth, and I just as well, associated it to that cheese that I ate, and I wasn't sure if maybe that was it.
And that's the tricky thing about these things, because sometimes, I mean, like we keep using the example of the apple, but you could have an apple and then 2 minutes later have the cheese, and you wouldn't necessarily correlate it to the apple because the cheese was the last thing that you ate.
Cheese, right.
But it could be the apple, which is why a test is pretty helpful in determining exactly what it is you're sensitive to.
Okay.
All right. Thank you, Rob.
Thank you very much.
That raises the issue of latency. So how long after you have a particular food will you have a reaction, or can you have a reaction?
Anywhere from the minute you eat it to 3 days after.
3 days?
Yeah, it's a delayed hypersensitivity, so that immunoglobulin, that immune molecule, can come up anywhere from today to 3 days after, which is why it's so tricky to figure out exactly what it is that you're sensitive to.
Okay, and in Rob's case, he was talking about a particular taste in his mouth. But would that be indicative of an intolerance?
It could very well be. It's really hard to say. Everybody's bodies are so different, and everybody manifests food sensitivity so differently that the only way to do it is to try to like eliminate certain things and see if that resolves. Sort of like same with the lactose thing. You know, the way to figure it out is just to eliminate the lactose and see if your digestive symptoms resolve.
Okay. In terms of lactose intolerance, you get a lot of gas, a lot of sort of stomach symptoms, if you will. But what about some of these other intolerances? What's the most common symptom?
I think a lot of digestive stuff does come up, most definitely. A lot of gas, bloating. A lot of times people have the sort of IBS symptoms where they've had diarrhea, constipation. But a lot of times they get headaches, sinus pain, congestion, acne, lots of different things. It's really, really very individual, very dependent on the person. Fatigue, too. That's a big one.
Okay, back to the phones and to Lynn in Trenton. Hi, Lynn.
Hi, how are you?
Good, how are you?
Oh, not too bad. I'm kind of concerned about my daughter. She's in her early 40s. She started getting hives, and then she started getting an awful lot of swelling, and it reached the point where her tongue was swelling, her eyelids were swelling, her calves were swelling. She's been to the allergist. Everything came back negative. She's been to her doctor. All her blood tests came back negative. They did give her an EpiPen, but that's just about where she's left us. They put her on Anthrax, I think it's called. No, Atarax, sorry.
Atarax, okay.
Atarax. But she finds she takes that and she only has to wait it lasts for about 2 days, and then something else swells up her tongue or her eyes, and she has to take it. And so I'm kind of puzzled, and what worries me, I think, more than anything is swelling.
Oh, absolutely. It sounds like it could be an emergency. Is there any connection with what she eats or when she eats?
I don't believe so. I've asked her that, and they did a whole string of allergy tests, including the food ones.
Yeah.
And everything came back negative.
So no specific food, no peanuts, or there's nothing that, even just in the allergy testing, that they determined that was sensitive for her?
Not
or
a
allergic?
thing.
Nothing?
No.
Okay. I mean, one of the things, food sensitivity is basically what they do is because you have this immune reaction, they can just burden your immune system. So they cause inflammation, and any kind of inflammation just can be an extra burden on your body. So I'm not sure if this would necessarily resolve her problem, but it might help in terms of decreasing that inflammatory load. And inflammation causes things like swelling, and it causes sort of that water build up in your body, and it causes all those kinds of things. So it could be a factor that could help reduce some of the problem, but I'm not sure if it'll necessarily eliminate it altogether.
So if she had an allergy test and it found nothing, but she had an actual food intolerance, it wouldn't necessarily be picked up by the allergy test.
No, exactly, right. And vice versa. So that's why I say to people, if they come in and let's say peanuts is something that they're allergic to, if peanuts does not come up on their intolerance, doesn't mean that they're okay with peanuts. They still should avoid the peanuts, because they're two completely separate molecules, and we're testing for only one individually.
Okay. Because, yeah, I guess you have tests, but you also have a person's experience.
Right,
so
exactly.
If you know it's going to cause a problem, then you got to avoid
100%.
it.
And I tell people all the time, just because it's on your list, if you don't feel good eating it, please just don't eat it.
Okay. Well, good luck to your daughter, Lynn. We're going to speak next to Susan in Newmarket. Hi, Susan.
Hello.
Hi.
Hello.
Yeah, go ahead, Susan. You're on.
Okay. I'm calling because our granddaughter, who's 4 years old, is on a very restricted diet right now with no gluten or casein or dairy, that kind of thing.
Yeah.
And we would like to have her tested, and we want to know whether we have to put her back onto those things in order to have the testing done.
Ah, good question.
No, you do not. How long has she been off the things? How old is she? She said 4 years old?
She's 4 years old, and she's been off them for several months now.
No, regardless, her immune system should react to them if she is sensitive to them. So you don't have to reintroduce the things. You can just do the test, and then we can go from there.
And do they check for gluten and casein intolerance?
Yeah, they check for, there's a couple different companies. The one that I mentioned earlier, Gemoscan, they test for casein intolerance, and they don't test for gluten specifically, but they test for all the gluten-containing grains. So really, you can just extrapolate the information from it.
Okay, thank you very much.
You're welcome.
Thank you, Susan. So in the case that Susan presented, if someone hasn't been exposed to the thing that irritates their digestive system, is it part of the test to introduce it to the person, or is it sort of in the testing of the blood itself?
It's in the testing of the blood itself.
Okay.
Yeah, so it doesn't make a difference whether you've had it or not. Even a lot of people call and they say, what if I'm on certain medications? Those things don't matter as much as either. So.
Okay. Well, it's time for a short break here on Talk TV. We still have a lot more show ahead of us, so stay with us and we'll be right back.